So I've trained at 2 different gyms before, and we do this drill in both gyms as part of our warm-up. I'm sure most of you guys have seen it, but it looks like this forward butt scoop. Okay. So whenever I see sometimes some guys in the gym don't have the flexibility to be able to dig that heel in and then bring that body up towards that knee so that the heel comes up to the butt. They, for whatever reason, don't have that flexibility, so they're usually going to be the ones that have the hand down and have to push forward. Not because they're weak, because that body you just can't get your shoulders up over the pelvis to be able to sit upright and then pull yourself in because the knee doesn't want to get to this point. So what I'm looking at here is where's the lack of flexibility. Chances are it's going to be posterior thigh, posterior hip. Okay, so can you get that flexibility back to be able to do that movement without having to use your hands? So here's a couple tips I think might help out. Is we can go ahead and use the foam roll to kind of massage out and get some length through the skin, through the fascial tissues, through the muscles of the hamstring, IT band, to get the ability for this knee to come up towards the chest. So probably seen a lot of people do the good old hamstring foam roll. If you follow the rules that I like to kind of tell about, you can turn the leg inwards, strike at the inner thigh or the inner hamstring, turn the leg out to get a little more of the outer hamstring, parts of the intersection of the IT band to the outer hamstring. But to be more specific to this case, to be able to do that butt scoop, what I want you to do is try to pre-position your muscles that are already in maximal lengthening, right? So instead of come back here on your, putting pressure on your hands back here, go ahead and try and see if you could lean forward. Bring the chest towards the knee, because that's essentially what we're doing, is bring the chest towards the knee. Now you have your muscles in a lot more tension, a lot more length. And then now go ahead and try and see if you can move back and forth. It's a little bit harder to kind of get through the whole length, so you might need to cut it up into chunks. Probably want to spend more of your time on the middle of the thigh and also closer to the hip. And then roll back and forth. And again, you can go ahead and kind of roll to the outside. Or you can roll, bring the other hand down, get a little more to the inner thigh. Again, wherever it hurts, where that tissue just doesn't really like it, that's where you spend a little more time. Now that's just more for the back of the thigh and the hamstring. Now if you want to get a little more back to the hip, I like to do this. Bring the knee up towards your chest, go up as high as you can. I like the other leg to be down. Hey, buddy. Down, other leg is down, okay? Then I want you to do a combination of bringing your leg across and rotating externally, or the foot's going to go inside of the knee. So I like to have the hand on the knee, the ankle, this other hand on the knee to push this way here. And we're thinking about bringing this knee and this foot kind of up towards this left shoulder. But the focus is going to be mainly on bringing the knee up towards your chest to bias specifically for that one position. So then I can go ahead and try and stretch this way. And try to, you might need to play around with it. Bring it up, you might need to do, some people might need to do more external rotation, some people might need to do a little more adduction to get that stretch. Everyone's gonna be a little different, so you might need to play around with it, to trying to find the right spot. Again, I like to have this leg down because this pelvis is going to what we call posterior rotation, but if you have the other side going to anterior rotation, puts a lot more tension into the pelvis, locks everything in, and you'll feel the stretch a lot better because the muscles will have to stretch a little bit more. After doing those 2 stretches, go ahead and retest afterwards. Or you can just go ahead and do the butt scoop, and you can re-educate those muscles to be able to teach them that you do have the available length and the flexibility to go ahead and bring that knee up toward that chest, okay? Try that out. Hope you have fun with it.